For patients with relapsed refractory CLL, Ibrutinib is a standard therapy that's now approved. Obinutuzumab is also FDA approved in CLL, and there are already combination studies that are incorporating these two drugs. But our study is asking a fundamentally different question, which is specifically, does the order of administration of Ibrutinib and Obinutuzumab matter, both in terms of the safety and the efficacy of the combination? We know that Obinutuzumab can lead to relatively high rates of infusional reactions, which can be potentially risky for patients and certainly disconcerting. And so our goal was to see whether Ibrutinib may be able to blunt some of these responses in terms of infusion reactions. And that's why we set this study up as a 3-arm study. So in the first arm, we start patients on Obinutuzumab as we normally would, and then we add in Ibrutinib during the second cycle for a combination period of 6 months, followed by Ibrutinib maintenance. In the second arm of the study, we actually start with the Ibrutinib for a month on its own, and then introduce the Obinutuzumab combination for 6 months, followed by Ibrutinib monotherapy. And then in the third arm, we start both drugs simultaneously, do 6 months of the combination, followed by Ibrutinib monotherapy. And we hypothesized that by starting Ibrutinib first, we would actually be able to blunt the cytokine response that we think causes the immune-mediated infusion reactions with Obinutuzumab. For this study, patients were eligible for any age group, but they had to be relapsed refractory in CLL and not have prior exposure to Ibrutinib or Obinutuzumab. So in the study results that I'll present here at ASH, we treated the first 28 patients, randomized to one of these 3 arms. And the results we've found so far have been fairly striking in terms of the difference in infusion reactions. In that first arm, where we start with Obinutuzumab on its own, we've seen a 63% rate of infusion reactions, which is in the range of what we'd expect for Obinutuzumab. In Arm B, we saw no infusion reactions, and in Arm C, we only saw 1. So out of the 16 patients in those 2 arms, only 1 reaction, so dramatically less than what we saw when we start Obinutuzumab on its own. So we think that already, even with the study not being yet fully accrued, that we're seeing a clear signal that it makes sense to start Ibrutinib either before or at the same time as Obinutuzumab. And in terms of the efficacy, the results also seem promising across the different arms. We're seeing a high rate of radiographic complete remission, and we've had a patient already get to a IWCLL complete remission as well. So we think this will be an effective combination, and we hope that our study will inform the design of future combination studies so that people will sequence the Ibrutinib and Obinutuzumab in the optimal way, both in terms of patient safety and potentially efficacy as well.